I invite you to visit our booth at the event platform where you can find out more about our solution. I'm very excited to be part of this Center of Excellence initiative, the Healthcare Innovation Challenge, and I will be a host for the finale. The Healthcare Innovation Challenge was conceptualized as a platform where healthcare service providers, medtech enterprises, or even technology players can bring their digital technology challenges and get those addressed by suitable, curated solution providers from the innovation ecosystem in the country. The first edition saw participations from 7 hospitals. Some of them have started the POC already, while others are in the stage of techno-commercial discussions. It gives me immense pleasure to inform you that 2 of the hospitals from the first challenge, namely Rajiv Gandhi Cancer Research Institute, New Delhi, and Zydus Hospital, Ahmedabad, are with us in the second edition as well. To kickstart this event, I'd like to invite Mr. Sanjeev Malhotra, CEO, NASSCOM Center of Excellence, IoT and AI, to give the opening remarks. Over to you, sir.
All right, thank you so much. What a pleasure to be here and in welcoming all of you, the speakers and the audience together. What a great success we have made out of this program so far. Coming from our first edition to second, the fact that we have come to a second edition tells us that we had a great response in the first one, and there was a requirement and a need to do a second edition that will also take us into a third edition. Just to tell everyone, give a background to people who are new to this, the Healthcare Innovation Challenge was designed and targeted mainly for the healthcare service providers, which, whether it's hospitals, larger or smaller, to address the requirements, their requirements from the digital side. As NASSCOM, the Center of Excellence, which is a joint initiative of MIT, the Ministry of Electronics and IT, together with the state governments and NASSCOM, have started 4 centers in different parts of the country for the purpose of nurturing more innovation in the newer technologies and having them adopted in the different sectors and the different domains in the industry. Healthcare is one of the highest priority sectors for NASSCOM, and there are multiple initiatives that we are running, which will be targeted for enterprises, the medtech companies, the pharma companies, the healthcare service providers, and the community as such. The areas of the project that we do in the far-flung areas where healthcare is not formalized and do not have a formal healthcare delivery system. So our initiatives are spread all over, but this initiative, which is targeted mainly for the healthcare service providers to address the requirement, how do we take the innovations coming out of the country by all the startups and mid-sized companies or even the large companies, how do we have them get adopted and make a difference and improve the healthcare delivery from the hospital side of things, which is the largest vehicle for healthcare delivery for us. And we all have been beneficiary of that system in the hospitals, the doctors and the other medical staff that we have all witnessed in the last 1 year, the kind of the pain and the difficulty they went through for our benefit. The first edition, we had participation from multiple hospitals, about 5 hospitals, and a lot of these problem statements that were given, the use cases were actually addressed and adopted by the hospitals. In the second edition, again, we have participation from many different hospitals and some of the repeat hospitals also. The fact that they felt there's a lot more that needs to be done, and the fact that we have a very vibrant startup ecosystem in the country, and of course we are one of the strong IT powerhouses, which we'll all hear from our next guest, and the fact that we are doing so much for the world. It will be our responsibility to make sure that our different sectors in the country do get benefited from the immense talent and the startup, the innovation that is coming at all levels. So with that, I'd like to welcome you all again. I'd like to welcome our esteemed speakers, our partners from Siemens, AstraZeneca, GE, Microsoft, and all other companies who have joined us here. And also would like to invite our next guest, Mr. Mr. Kiran Karnik, who does not need much introduction. In fact, we have a privilege of having two Padma Shri awardees today with us in succession. I did not have that privilege earlier to be in company of two Padma awardees in one session. So Kiran Karnik ji has been a luminary in the industry who has made his contributions in the industry, starting from science and technology into broadcasting, and then into as a NASSCOM president, that brought our country to the preeminence in the IT outsourcing. Then when we really saw IT outsourcing, India being the preferred destination in the world, and they're on continuing the growth, that trajectory that we are still on. And Mr. Kiran Karnik, who has had an immense contribution into the IT industry to get to that point. And it gives me immense pleasure to invite him to be our next, to speak and share his thoughts, who's been on boards of multiple companies and as well as driving some of the healthcare initiatives at a national level also. So, sir, it's been absolute pleasure and my privilege to invite you to share your thoughts with us.
Thank you, Sanjeev. Indeed, delighted to be here amongst you today. This is an event of great significance. And first, my congratulations to you, Sanjeev, and to the COE team. This is the second edition, so clearly you've had great success and going forward. I know about some of the work being done, and it's very, very impressive. This is in many ways the COE, very, very unique. It's a partnership between center, state, more than one state, different locations, and the industry through NASSCOM. In this area, more than any others, it's tremendously important because state are, you might say, mandated, or health is a state subject under the Constitution, and yet the center plays a very major role. And industry is an increasingly important player with the kind of developments that are happening across the board, bringing in different sectors, bringing in electronics, computer software, sensing, biological sciences together. This is something which industry can best do and take forward. And innovations are key to this. So this challenge is something which is taking the whole health area forward in a big way. And I think already in the years to come, I see it as being a major way of really achieving what we need to do. But I want to step back for a moment. I'm sure other speakers will touch on many other aspects. I want to just take a minute or two to set the context. When you look at where we are in this very crucial area of health, which is one area, we speak of many areas of being important, of being matters of such relevance that their life and death matters. Well, here is one that, as we all know, is literally one of life and death. And it hit us all very hard personally, particularly in the last year and a half, when some of us have had the misfortune of seeing people whom we know very, very well, friends, relatives, near family, fall sick, get us worried, in a few very unfortunate cases even pass away way before they should have. And health and its importance has struck us as never before. And therefore, to me, when I speak of this context, I speak of it with some degree of sorrow that over these years, this is one area in which the country, as we have made rapid progress, has certainly in a comparative sense, but even in an absolute sense, not done too well. One overall indicator is the so-called Human Development Index. And despite all our growth, development, or technology, or capabilities, we are 131 in 189 countries. And our neighbors, countries like Sri Lanka, Bangladesh, of course, China, are way ahead of us. When I look more specifically at health, and I look at figures which are indicative, when I look at child health, look at infant mortality, look at indicators within that which also indicate nutrition, things like wasting, underweight, factors like those. And again, I see that our figures are very bad. And in fact, again, our neighbors, and I talk of our neighbors, not just as people who are near us, but people who share in many ways our culture, our genetic makeup, and many other factors that determine what health would be. And our neighbors are ahead of us again. Countries like Sri Lanka and Bangladesh are way ahead. In many cases, so is Nepal. And some countries like Vietnam are way, way ahead. And these are countries which have been like us. They are developing countries. They are not rich countries. They don't have a great deal of resources. When I look at one last indicator which I want to mention, which sort of sums it up in some way, is life expectancy. And when I look at one figure, it makes me reasonably happy. The fact that we have moved from a life expectancy of about 50 years in the 70 to 75 period, 1970 to 75, we've moved up in a big way to almost 70 years in the last period for which data is available, which is 2015 to 18. So we've jumped almost 20 years in life expectancy. Great progress, you might say. And yet, when I look at our neighbors, I see that China reached that figure in 1990, 30 years ago. And they're now at 76.7. Not only that, countries like Nepal and Bangladesh are also ahead of us in life expectancy. And I think it says a lot for what we have not done. And finally, the indicator of that is the expenditure on public health. We are well below 2%. If I add even the private expenditure on health, which is very substantial, it comes to 3.5%. Other countries spend much more of their GDP on health, taking care of public health of their citizens. Countries like UK spend 9%. Countries like the US spends a whopping 17%. Obviously, they have a very expensive healthcare system, as we all know, but yet it's indicative of where priorities are and where the money is going. I did want to spend a few minutes by intention on this context because a lot of what we discuss is related to this and the problems it creates. But as we've always said, every problem, every challenge is in fact an opportunity in disguise. And here is a fantastic opportunity, and an opportunity which is unique because for those of you who are involved, and Jamia spoke about her startup, I know there's so many of you others who have startups or who have plans to do so, or are creating new innovations. Here is something that's exciting. It's a possibility of really doing breakthrough innovations in an area which desperately needs them. More importantly, in terms of your own satisfaction, and I particularly address young entrepreneurs and startups in this, is a chance of doing well as you do good. Tremendous business opportunities, and yet a chance of getting the satisfaction of saying you helped so many people live a better life and get better health. Now, why are these innovations so key? Why is innovation of all things important? It's because the kind of problems we have are not only unique and special, but they call for different kinds of solutions. Sanjeev spoke briefly of remote areas and faraway places. Many of these places have poor to no medical facilities. If at all there's a public health center, there's often no doctor. If there's a doctor, he or she is often not there. Medical supplies are difficult because logistics are bad. If you need a cold chain, it may not exist. So things like vaccines that require a cold chain very often, other medicines, it becomes difficult. So we have huge problems. You don't have specialists there. How do you cope with this? And yet we have seen solution after solution come for many of these problems. Many, many years ago, I was involved in my days in the Space Research Organization. And unbelievably, it was 40 years ago that we did the first telemedicine experiment. And we were able to establish, even in those days, 40 years ago, that telemedicine was viable, useful, and something for which even at that time, technology existed, though it was more expensive and more complex. Today, it's completely feasible. And many of us in urban areas have practiced it, worried to go to a doctor when you're not feeling well amidst a COVID wave, and you do it even through a WhatsApp call sometimes, and you're able to give your data to the doctor. The doctor gives you some kind of diagnosis. Now imagine how critical this could be in remote rural areas where there's no nearby doctor available, where the nearest doctor may mean a day's ride by an uncertain bus, bullock cart, tractor, whatever. Can you provide them these facilities? And can you do it, most importantly, in a way that's not too expensive and yet gets the data, takes care of the problems we have, which may be low bandwidth connectivity, it may be intermittent internet, it may be power problems. And I think these are areas that are just, crying for innovation. Take another area, diagnostics. And I know many of you have done work in this area. Can you make diagnostics simple, automated, and not dependent on high-level expertise. I repeat, many of you have done it, but can we do more? Can we begin to see how you can push the benchmark on these, where you can do things maybe even non-invasively, not a drop of blood, but maybe a sweat, teardrop, skin temperature, anything that's non-invasive, simple to do. A paramedic can be trained to do it. An ASHA worker in the village can be trained to do it. Something as simple as that. Working with very, very complicated backends, machine learning, artificial intelligence that has gone through millions and millions of data points to be able to say this plus this probably means this. And that's good enough. This is the big advantage when you're dealing with things like this. You don't need to be 100% certain. If you can tell that patient there that, look, there's a fair possibility that you have a problem, please go to a doctor or a hospital. I think that's good enough. If you can tell them there's a fair possibility that all you need is just some rest, do that, wait for a day. If it doesn't go, then look at going to a doctor. I think that's huge. It saves them time, money, worry, everything else. I think these kinds of things are critically what we need to do. The other factor, and I want to spend a minute on this because it's an exciting new thing that's come up. As you know, the Prime Minister launched it just a day before yesterday. This is the PM Digital Health Mission. This will help to digitize all kinds of health data about hospitals, about doctors, your own health records, which can then be shared where you go. They'll be portable. You will own them. Nobody can get hold of them and take them. So privacy is being assured. And yet, if you move from place to place, if you go somewhere else, if you want to consult a doctor, you can instantly share your past health records with that doctor. You can send it to a specialist if you're in some smaller place and need to consult a specialist. You can refer to wherever you are to where is the doctor, because it will have a database of doctors, it will have a database of hospitals. This is going to be exciting. This is the equivalent to me of the Aadhaar or UPI platform. And the opportunity for innovation on this platform is phenomenal. It will be something on which apps can write. It will be something on which those who are interested can create new apps and create new services. But this database, to me, is going to be, as I said, the new UPI. So here's an opportunity for far more innovation and far newer innovation to take forward what we've been talking of here. All in all, I see that the prospects for what we might do in this area are both necessary and very large. We have huge needs in the country. I talk mainly of rural areas, but let me stress there are equal needs and requirements in urban areas. It may be older citizens, people like me. I'm yet fortunately mobile. There may be people who are immobilized, who can't get out of the house. They may be a kilometer from the hospital, but they can't move easily. Can you provide remote healthcare to them at the minimal level, where they don't necessarily need to go to a hospital, where they can do a lot of consulting from where they are? There are requirements for those in the more crowded areas, the slums in our place. The epidemiological requirements, which require massive amounts of data analytics, a lot of modeling, things which computers, computer software, and the IT industry does best. In all these, of course, it has to be an effort which involves different disciplines. As in all great innovations, great things happen at the intersection of disciplines, at the cusp of disciplines. Here it's mainly healthcare and information technology, but it well could be other disciplines that come into the play. And where you have this intersection, I think there is both scope for innovation and a huge opportunity for innovation. So I'm very excited. I've seen some of the things that have been done, all the exciting things from low-cost simple diagnostics to somebody who's converted a normal hospital bed into an ICU bed at 1/10 of the cost, to mechanical innovations like cardboard box beds, which have now been much written and spoken about. All kinds of innovations spurred by COVID, but also ongoing now. And in a number of other areas besides those that immediately affect us through the epidemic. So good luck to all of you, and my congratulations to all those who are pushing the innovation pedal. Please push harder. We desperately need more innovation. This is an area of tremendous importance for the country. I started with giving you some dismal figures because in so many other areas, we are proud of what we've achieved in this country. This is one area in which, very frankly, we have to hang our head in shame. I am hopeful that in the next 3, 4, 5 years, we will completely transform this area. And we will be really, truly a healthy country, certainly, if we are not yet a prosperous country. Thank you.
Thank you, Mr. Thank you, sir, for such an inspiring speech. I'm sure that, with your wisdom and support, this initiative is going to benefit immensely. I once again thank you for taking out time to join us today. We are honored to have with us the Padma Shri, another Padma Shri awardee and former physician to multiple presidents of India, Dr. and Professor Mohsin Wali. Dr. Wali does not need any introduction and is well known for his work in the field of medicine. He has accepted our request to share his knowledge on how he sees the role of digital technology in the domain of healthcare. I would now like to invite Dr. Wali for the medical keynote. Over to you, sir.
If you could please unmute my video. Thank you. Yes, good afternoon, everyone. And good afternoon, everyone. And I'm very fortunate to be here on this platform and especially blessed by a senior person like Mr. Kiran Karnik. And while I will be sharing my screen and continue to talk, it will be a good thing to talk about healthcare innovation challenge, and you are completing this phase 2. Congratulations to all of you, to NASSCOM, its members, its team, its researchers, its awardees today, and a good team headed by Mr. Sanjeev Malhotra, who is CEO of NASSCOM Center for Excellence. And my salutation to Mr. Kiran Karnik, and I'm sure an institution with the blessing of a person like you would flourish beyond imagination, and with the dynamic team of people like Shyanika Hazarika and Dilip Mangsuli and Sudhanshu Mittalji is with us, and Sonia ji, who is heading media, and Shantanu Gaurji, and Ramya, of course, along with backdrop Mohit. And it's a team which matters. That is what we were taught in medical curriculum also. We were taught this thing. And I am feeling it today. I'm feeling very excited to be with you, especially with my seniors and youngsters, especially who are doing innovations. And I'm proud of NASSCOM, which is giving good gifts to the nation through the very honest and dedicated research through the Center of Excellence of IoT and Artificial Intelligence in India. I just made this slide last night, which sir was talking. And yes, this is one example for a huge country. If this works, it would be a perfect boon to the country, and it will create an example how we can unite the various ends of a big country like ours. I will take you to the old, from where the journey of this medical science began. That is, when you invite a person like me, I will always go to my past and remember how I was bringing medicine for my family for 1 rupee 30 paisa. And these were the forms of simple medications, simple liniments, lotions. And this was the old pharmacy, which you children, when you will see, you won't believe. You will say this is a junk of a chemistry lab. And these were the packages. And from India also used to go Indian oil, which was sold at Ohio for 50 cents. So this all made India very proud. You see, at that time, old time, we were sending stuff for a country like America. And not only medical science, but dental science has made a lot of progress. If you recall, in the old days, sir would recall that a dentist shop, it was never a clinic, it was a shop. And there was a board of 32 dentures. And at the top of which there was a cycle tubes, rubber valve to hold it at the palate. So we have made a lot of progress in dentistry too, which I've just touched by showing this, that we have gone beyond and at international level, we have modernized the dentistry as per international, and we are doing implants now. And this is not the end of the story. We have further research to be made, and we are talking about vaccination certificates around the globe. I could get this Ottoman Empire's Sultan Abdul Hamid's 1908 certificate, and there used to be vaccination certificates during the days of cholera outbreaks. They were wonderful, and this is what my daughter sent me 2 days back on my WhatsApp, and I made a slide of it. Still today in developed world, we have not made sufficient progress. There are still countries where more vaccines are required, and the tug of war is going between advanced countries and less advanced countries. So we have to go beyond all this. Now, I will be a little spiritual. What we have been taught in the history, in the ancient times, the first thing which Lord Ganesha teaches us, think big. Unless you think big, you can never innovate. I'll recall President Pranab Mukherjee, and he was so fond of innovations, and whatever university he would go, he would make an innovation department separately, and next time he would go for another convocation, he would see that thing has started. So first thing is think big, listen more, concentrate. That's what Ganesha's small eyes tell us, concentrate, talk less, and realize that you need blessings, you need sadhana, and with that, you have high efficiency and adaptability. I was very happy when I saw all you youngsters having so much efficient discussions, and you looked very brilliant to me, all of you, and credit goes to all your bosses and to you as well. And then peacefully digest all good, pick up all the good and leave away the bad. So all these things which have been taught by the ancient literature in medicine, especially by Charak Samhita and Shushruta Samhita and Puranas and Vedas, is still work. You see, when I was doing my studentship, I saw a description of diabetes from the Charak Samhita, and things are there, you see. And same, if you go to the modernization, I'll just toss between old and new. And this is what IoT, you have a special segment. And for that, this lady, Lydia Gladino, has done some work for internet speed. Maximum internet speeds are still higher in Australia now. And with this, we can talk, we can join, we can work together. And the world becomes a smaller, world becomes a global village, and world becomes one. And that is what we aim at. So some of these points I will touch during my talk, which you people have designed, and you have also devised awards on these points. You see, when the day started in our days, we used to go to the wards and see the pulse of the patient, and our teachers used to teach how to feel pulse and what good things we can diagnose by seeing pulse of a patient. And in emergency room also, we have to go and see the patient and use the stethoscope and see the pulse. And this is where the whole world revolved around. But now we can have a lot of things for successful approach to the patient. We can join, integrate, and analyze in the emergency medical room itself. I was very happy when I came to Delhi and I went to one of the corporate hospitals, and in emergency, they were doing echocardiography at the receipt of the patient. And this was what I always thought of being done when the patient comes to the hospital. And I was so happy and pleased to see that is being done there in that hospital. I always do echocardiography when the patient walks into my clinic to know more about the patient. And this is one video I would definitely show. It has audio also. So if you give me 1 minute, it is a short video. I'll play this.
Use of innovative point-of-care devices carried at the location of the patient's care, at their doorsteps, in hubs, camps, at patients' bedside table to bring efficiency, in care delivery. Tricog, a cloud-connected portable device that makes the interpretation and analysis of an ECG report quick and easy. Patients receive cardiologist-certified ECG reports within minutes that can be easily shared with the cardiologist for an accurate diagnosis of ECG reports. Scanbook measures vitals like blood pressure, body temperature, heart rate variability, respiration rate, blood sugar, and blood oxygen to diagnose and refer patients to the next level of care in case in need. Braveheart, life sensor cardiac monitor, a wireless monitoring system for monitoring of physiological data transmitted wirelessly from life sensor electrode to an application on an iOS device for review by healthcare professionals. Integration with our wireless healthcare incident monitoring system, also known as WIMS, helps clinicians to store and retrieve patients' medical history required for repeated consultation, dosage change, and referral services. This also helps clinicians with critical information for effective treatment. All the data stored brings better healthcare, awareness, precision treatment, and chronic disease management, bringing positive health outcomes with reduced resources and reduced costs.
So the key takeaway is all this amalgamation of various methods. We call these days as variables. And every home has at least today an oximeter and a beep instrument and a gadget, even this thermometer. So people have things now, and they have realized, and they have smart watches, and they have many things, and youngsters do believe in gadgets. So this gadgetry is a very good thing to have. And we have to amalgamate the resources to get best results with the, as Sir has said, best financial integration and outcomes. And similarly, gone are the days when our hospitals used to work in a common way, and then we used to have some scanning material like this, and they were the basics. But now we require operational excellence, and we require to improve the patient-doctor relationship. Many other things like limit hospital-acquired infections, care, and how to achieve all this. We have constraint of time, money, space, and technology, but things can be done still with innovation of youngsters like you. We can have operative goals, we can have connectivity. I've just shown the connectivity, master the systems, integrate them to the use of patient, and revamp the technology in a cheaper way, as Sir has pointed out, very important, and link the devices, mobile devices, even the handband in the patient, which is called RFID band. You all know more than me about these things. Integrate all with the trolley man, with the reception, with the emergency room, with the counter, with the operation theater, and we can build up the best response to the emergencies this way. And these are some small examples, like in radiology, as I was seeing Dr. Mahajan's logo, so I thought of breast cancer's example to be given. We can classify after a lot of AI superimposition, a patch classifier, which will amalgamate lakhs of images, and it will classify as benign and malignant, and within instant time after this data, it can give similarly, it can give the results. Similarly, in a mammogram or MRI of the breast, it's a very important thing to diagnose, and it's for the relief of masses. Even these portable systems can be taken to villages, and we can diagnose the breast lumps. Of course, this is MRI study. Through AI, we can diagnose, and for the naked eye, the images may look same, but through AI's application, we can have a difference, and it can lead to an efficient diagnosis, which will save a lot of money and a lot of manpower. So at one point, this equals human doctor. Now, I will go back again to the surgical side of this story. Gone are the days when surgeries were done like this. And you see the picture, telltale picture with the Bible at the hand, with the name of God, with the person operating. And it has now boiled down to a very important surgery and radiotherapy. Of course, I will be showing this brief video. Uh, and these are the things which are developed not overnight, but after sustained efforts. And they are safe, they are very important. And these gadgets are very accurate, precise, simple also, accurate also, safe also. This is showing how to precisely deliver the therapy to the operated patient of the breast cancer. And the machine is locating the lesion, the patient, and delivering the therapy. And this is what most of the modern hospitals in India still don't have. So we have to go from that primitive bottle of the medicine to these. This is the fixation, and the machine is going to deliver the required therapy, and within 2 minutes it will safely deliver the laser guided dosing of the therapy, and that's how it works. So in every field, another area we are locating that future trends for digital pathology and immunohistochemistry. As Sir was saying, that we have to conglomerate. This is dedicated to Mr. Kiran, that it's a simple microscope with artificial intelligence incorporated, and digital. It is a digital system, and it has been increasingly used by large biopharmaceuticals and top clinical research organizations. And this is further developing. You have heard of 3D printing also. So the conglomerately, we can say digital pathology can improve quality in meaningful ways, like improved analysis, reduced errors, and provides us better views. I won't go into the details, but I would say that time is not far when we would be having accurate analysis of our all samples, accurate diagnosis in pathology, and this will do a lot of scanning and other costly investigations, do away with all these costly investigations, and we can get the correct diagnosis. And recently we have seen, and Dr. Harsh Mahajan, my friend, has given a talk on this, how to do this analysis of CT scans, segmentation of lesions, classify the COVID scoring by the help of imaging and artificial intelligence. And you know, we can do it. Today we are doing it. I'm proud to say most parts of the India and bigger cities and good corporate hospitals with people trained at your centers, like other centers and your centers, are efficiently doing this service to the humankind and saving lives. This is very common door to door, and all the doctors are using this outpatient system. And patients are also getting their prescriptions on WhatsApp, as I was telling. And so this is already in practice. In the future also, uh, with reference to pandemics, in the future days, artificial intelligence may help predict next virus jump to the human, and data is being collected, is stored, and analyzed all over in the bigger centers of the world. Now, another aspect, humans love flying, and this is the Takhte Taus old, the historical time, Kavas. And what we have in Indian literature is Pushpak Viman. So we have been flying, and the flying is one of the qualities of the human being, and which it has learned from the birds. And now you might have heard about air ambulances and saving lives, and lot of advantage. It's time saving, heart transplant, transfer of the transplant to be transplanted organs. And this is one example which is being used for vaccine transportation. And as I am a cardiologist, I'm very fascinated by this video. Please see this video. This is my probably last slide. And after that, you will get a great message from this slide.
I think he had a heart attack. Please help. He's not breathing anymore.
Please stay calm. What's your name?
Joanna.
Good, Joanna. We've got your location. The ambulance drone is on its way. Remove his top shirt to uncover his torso.
Okay.
Great. Can you go to the nearest exit? The ambulance drone is almost there.
Okay. I'm outside.
I'll be talking through the drone now, so you can put down the phone. Now please pick up the drone and bring it to your father. You're doing great. Okay, pull the green lid. Now place the pads on your father's chest. Good, I can see that the pads are properly applied. Joanna, please stay clear of your father. We'll take it from here.
So this drone has medical uses also, and is life-saving. And what equipment gadget you have seen in this is now being placed in the larger cities, in the malls. But people have to be trained about how to use this cardioverter defibrillator. In the future days, we will have all this, they will become cheaper, and we will have them at all the petrol pumps and roadside. This is my dream as a cardiologist. I wish so. And now seeing all this being remotely managed by artificial intelligence, whether it is the brain chip made by this, he has still tried on the pigs, and or it is a smartphone connected contact lenses, which give new meaning to the iPhone. These are the gadgets which we are using. They are available, and we have been seeing this. And artificial intelligence is to be used for the benefit of humankind, as this cartoon says. And there are a lot of concerns about using artificial intelligence. We know how and when it is to be used, but the best thing is what I liked is Albert Einstein's quote, that logic will get you from point A to B, imagination will take you everywhere. So I wish your imagination, which is always beyond my calculation, will take you to the newer heights, and with the leaders like what you have, like Mr. Sanjeev and our seniors which we have, India is not far behind seeing a wonderful tomorrow in which we will be leading the world for treating, as we were the world leaders in the past for medicine. And I wish all of you a good, great success in your mission. And Mr. Sanjeev, your presence has made me very excited, and I was very impressed by your senior, and you have not forgotten to call him Mr. Kiran Karnik. I am very grateful for your kind words, and luckily I made a slide on Prime Minister's digital mission. I only thought it last night. And
thank you so much. Really appreciate that, sir. Great. We really thank you for your time and great words, and the experiences that you shared, sir, I think are invaluable. I don't think we will have that wisdom from anybody else. So, so with the interest of time, sir, I mean, we'd like to greatly thank on behalf of NASSCOM and to Kiran, sir, and we will definitely remain in touch with you for the further guidance on some of the things that you have shared with us. So over to you, Ramya, for the next. Thank you, sir.
Thank you again, Dr. Wali, for taking us on this journey of ancient and present Indian innovations and what's in store for us in the future. Our partners play a critical role by providing us extensive support on how we should conceptualize the programs for maximum impact. This is critical to how we define and execute our programs. I now invite Ms. Shayanika Hazarika, the Director of Healthcare, Microsoft for Technology, for her keynote session. Ms. Shayanika will share her knowledge on clinical innovations through AI and ML. Over to you, ma'am.
Thanks, Ramya, for the introduction and wonderful session so far with Mr. Karnik and Dr. Wali. And I am delighted to be part of this event, and thank you, NASSCOM, for this opportunity. Being in healthcare for almost, especially health tech for almost 20 years, I have seen the way the technology has evolved, and it's been evolving very rapidly. And every time it brings a new challenge for us as well, basically the technology vendor like us, to solve a new use case. And I truly appreciate NASSCOM for taking the initiative and efforts to encourage various startup and health tech company to reimagine healthcare, as well as to bring a common platform where both the industry players as well as the technology can come together to provide a solution to meet unmet use cases. And I truly appreciate the efforts being made by NASSCOM in this area. And I understand that none of us in this forum has an iota of doubt when it comes to the capabilities of technologies, as mentioned earlier by my previous keynote speakers, that technology has played a very critical role even in COVID situation, where technology has helped to provide healthcare services beyond during the COVID situation, beyond the boundaries or physical boundaries, basically, of the hospital. And I'm sure that this is the start of the journey, and we will keep continuing innovating in this area where technology will not be used only for automating the administrative tasks, but for more transformative journeys in healthcare, where technology can be used to enable healthcare provider or clinicians to provide more efficient care, or to HoloLens, where we can provide specialized care to remote areas, or to tier 3 cities where there is a gap of quality care. And in today's session, I won't be sharing any presentation, but would like to give examples of some of the veterans in healthcare industry. For example, I'd like to talk one of the statements made by Dr. Ajay from HCG, who is the CEO and founder of HCG. In one of his conversation with us, he mentioned that cancer doesn't know who can afford it and who cannot afford it. And in oncology, treatment cycles are long. It's too tiring and traumatic for both, not only for the patient, but also for the family. And there are times when the patients drop out in between of the treatment cycle because they can't afford it, or they are tired of the trauma of repetitive treatment cycles. And if technology or advanced AI ML technologies can help a histopathologist to identify a tumor at an early stage, or a clinician to provide personalized care or personalized medicine based on your genetics, imagine it will not only reduce the cost of care, but also it will improve the outcomes of the treatment, and as well as it can reduce the treatment cycle. And I know, and I have seen in various presentation, and that the innovations is going across, and even in NASCOM, truly appreciate that 80% of your case studies and use cases are related to oncology, and you have hit the right the channel, and truly appreciate, and good to see innovation around it. And it will really help India, where the cancer studies or cancer cases are really increasing. And another example which I would like to talk about is Dr. Devi Shetty, who basically has spent a significant amount of his time taking care of patients who cannot afford good quality care because the cost of care is rising. And when we talked to him and we asked him about trust, the word trust, he mentions that the biggest trust he believes is the trust which a patient has on the doctor. And he always truly tries to live up to that trust when a mother brings her child to him with the trust that he will be able to cure it. And if technology can help create a longitudinal view of a patient with right level of AI intelligence, the decision-making power of our clinicians can improve significantly. And also he can be confident of the treatment he is trying, or he has the treatment he is been giving to the patient. And there are a number of examples. I can keep on talking throughout the day, because I know that healthcare and technology can make a good transformation. But in the interest of time, I would like to talk about data, because data also plays a critical role and crucial role when it comes to success of any technology's outcome. And I have seen that there are a number of technologies also available to ensure the long-standing issue of disconnected amongst the data. And as my previous speakers have mentioned, there is NDHM initiative taken by government at a national level to ensure interoperability among various diversified siloed healthcare systems is another way to ensure that we have interoperability and standardization in data soon in this country. And even Microsoft also has come up with a very maybe 1.5 years back of healthcare cloud, which is specific to healthcare, which takes care of healthcare data at scale, and to ensure that there is an interoperability, standardization, security, and privacy are so important aspect has been taken care. And as Microsoft, we believe that technology can play a critical role in healthcare. And we believe that if we can give an advanced AI solutions in the hands of a professional, then they can have a better decision-making power and more meaningful connectedness or connect with the patient. And we have been investing heavily in AI ML, and we have a multidisciplinary team working across the globe. Just to give an example, we are working with adaptive technologies on immunomics, where we are trying to work with them to create a machine learning solution where the sequence, where the translation of a TRC sequence and how antigens and maps with the antigens it responds to, and this helps basically if the decoding of these immune systems can help actually bring the precision which is required for the diagnosis of either cancer, infection, disease, or autoimmune disease. And we are also working with Johns Hopkins, and our I would say our investments or our confidence in technology for healthcare can be seen in our recent acquisition of Nuance platform, which has number of deep learning AI ML technologies to help enable the basically translate the clinical services into the clinical conversations into the record. And this is really going to be useful for countries like India and Africa and other countries where the doctor-patient ratio is really low. And I'd like to end the session with a summarized statements for both the technology provider as well as the our industry participants, that if technology adoption is able to help you reduce cost of care or cost of or any other cost, basically the operational cost, or it is able to help you optimize the resources or your frontline workers, or it is able to help you create a new specialized services, then we can show an ROI for the investments. At the same time, I would like to talk to the technology partners like us, that we, considering them as a customer, if we can partner with them, be with them in their journey to show the outcome or clinical evidence of AI ML, the adoption rate also will be good. So thanks NASSCOM once again for giving this opportunity. Delighted to be part of this event.
Thank you so much, Ms. Shayanika, for sharing your knowledge on clinical AI with us. And we look forward to using this knowledge for our future programs and learning more.
Thank you.
MedTech enterprises for us play a critical role in the overall healthcare ecosystem. The Center of Excellence actively works with its MedTech partners who, apart from providing their invaluable support, also bring the domain knowledge about current and future trends. Apart from defining and refining the programs, this helps us in understanding what additional kind of initiatives we should take. I'd like to now invite Mr. Dilip Mangsuli, the Executive Director, Siemens Health in Years, to deliver the industry keynote. Over to you, sir.
Thank you. So, in fact, no, I want to start with what a great experience it has been. Just listening to some of the stalwarts. Mr. Wally's speech was just amazing. You will realize one thing, more you do in healthcare, you realize you need to do even more. Because one thing that we have come to know during the time of COVID is that it is not yet enough in terms of making the difference to the world. So I want to talk a little bit about it, the context that was put in, and I want to talk from the point of view of consumer. Consumer in this case is a patient. How does he see the technology? We always, as industry leaders, as technologists, we always talk about things that are transforming in terms of creating an outcome. But from a consumer's point of view, how is it changing? And how are the companies trying to look at it? I want to start with this particular thing that was done in 1978. All governments came together, World Health Organization came together. And they all said, okay, by year 2000, we will make sure the world is going to be having a stage where everyone has access to health. 2021, and we saw the world was in a disarray. The pandemic did not make it easy, and we had to really struggle to meet the requirement of the population. And we had to really figure out a way to manage this. Pandemic may be one-off case, but there are other diseases. If you think about it, it's a very interesting chart which talks about a couple of diseases which are taking the lion's share of the impact to mankind: heart and circulatory diseases, cancer, respiratory disorders. If you look at these three, they constitute more than 85 to 90% of overall impact that is being caused to the humankind. Now, with this being a real challenge, should where you live determine if you live is a very, very strong statement. Whenever I see this, I really wonder, does a person living in village has the same level of access as a person living in a city? Should that be a deciding factor if a person should live based on where he lives? I think it should not be. Care is today disjointed. And knowledge is, great thing is knowledge is accelerating. Everyone is getting to know more about possibilities on healthcare, possibilities of how do you manage your healthcare. And as all of you know, during the pandemic, we had the increase on telemedicine by more than three times. And as the recent estimates suggest, this sector is likely to grow more than 30% year over year. That's a great relief. If you think about it, we were struggling. We were struggling for quite a long time how to convert digital practices into digital solutions into practice. And of course, one positive outcome of the pandemic has been digital got the biggest acceleration it needed. Satya Nadella talked about it in one of his talks, saying that sometimes, for decades, nothing happened. And then in few weeks, a decade happens. And it's exactly what happened, right? In Siemens Healthineers, we strongly believe enabling better outcome at lower cost. I think this is what the world is looking for. As all of us know, it is end of the day, patient who pays for whatever technology we create. End of the day, the money is going to come from patient. And a new technology does not mean he has got more money to pay for it, but we have to really find a way to create a better outcome so that he does not end up spending higher amount. And that's what we are trying to look at it. If you think about the dynamics, what's changing, we strongly believe medicine will become more precise. And, we just talked about AI technologies. AI technologies definitely will help. Data that, a couple of days back, what the Prime Minister launched, the digital health stack policy, Ayushman Bharat policy. With this, the availability of data and how do you use this data with so many startups, with India having more than 15% of the startups focusing on health, this is going to drive solutions which are going to be more creating precise solutions that will help patients' journey much better. We believe value will shape the care delivery. And one of the main things, we believe the patients will become consumers. When I say consumers, they're going to be more engaged in managing their health. They're going to be more informed about what choices they should exercise for their health. This is going to be the future. And think about it, the new health stack policy is also going to give access of the data to the patients. And patients will get a lot of insights in terms of how they can manage their health. And with those directions, it's going to be a case of managing your health in a much, much better way compared to in the past where it was a lot more difficult. And I think, there was also reluctance from the patient's point of view to go to doctors and get treatment. And you will see that changing in the coming years. I actually love this concept of family doctor. And many of you know, the family doctor as a concept exists in India for quite some time. And I lived in China, and there was a very interesting concept of family doctor. And a family doctor in China used to be paid a lump sum money for a year's treatment of the family. And the money used to be deducted if someone fell sick. So very interesting concept where you were talking about keeping someone healthy is when a doctor got incentives, not when a person fell sick. Today, incentivization is more on, is a hospital bed fully occupied? that becomes an incentive. Whereas the family doctor was incentivized, if no one fell sick, he gets a bonus. If anyone falls sick, there is a deduction. So very interesting concept. And that is exactly something that we should be looking at. And if you think about it, what is changing there as a family doctor? He knew the history, he knew the things that worked for a patient, and he knew what did not work. And that's what we talk about precision medicine, right? Knowing very well what is happening with the patient and how do you treat correctly, knowing what doesn't work, what works, what medicine works was something great. And we are trying to bring that precision medicine to the population and transforming the care delivery in a fastest way, how you can deliver it. And most of all, patient experience is the most important one. End of the day, if a patient doesn't, whenever I was in a hospital a few days back, and I got discharged in the morning. And by the time I was actually out of the hospital, it took nearly 8 hours. So why does it take that long a time? And everything is important in terms of experience. And that's what we're trying to look at through digital processes. How can you drive these solutions that can be important? We have mastered this solution before. If you think about it, in the case of navigation, we've always used to ask, where am I? And how do I get there? And we actually found a solution, right? I'm at Siemens Healthineers in Erlangen, and I want to get to a place in Vienna. And if you look at it, today we know how to get there in multiple ways. You are able to reach there by car, by train, by aeroplane, and there are different ways the Google map will show you. That's a way that we solve the problem. And if you think about how am I and what is my path to good health, the same question. If you ask about it, do we know today? In fact, the data exists. Data exists on EHR, imaging, laboratory, genomics. And if you look at all this data, if you try to aggregate it, can I tell how can I get to a good health over time? And this is exactly what we are trying to solve by picking up the data from all sources. There are multiple sources of data available. And this source of data can really make a difference in terms of to get to where you want to. Think about, if you're starting the treatment today, if I do by only diet, I may take X number of days. If I do a surgery, I may take Y number of days. If I do diet plus medication, I may take some other days. And this is exactly what we are talking about, empowering the patient to make the decision. And how do you really get to a point? I'm showing myself as a image here where my heart as a digital twin is able to be assessed by myself. And over time, I'll be able to drive a solution on that. And innovation in healthcare are driving that solution. And in fact, it is combining of multiple people coming together. What we were talking about earlier, the startups. And these are all different people who will come and deliver a combined solution, the collaborated solution that can make a huge difference. And for healthcare, innovation is going to be a big differentiator. And consumerism, we talked about, patients prioritize today access to data, healthcare services over need for human interaction more so than before. We are having the data at the tip of your hand. You are able to access this data over your cell phone today, and that's going to play a huge role in the coming years. We strongly believe, and we are driving towards that. Is it tomorrow? Probably not. But absolutely very near future, we are looking at combining these data that we talked about and creating a very strong digital twin of yourself, a biophysical model of a human being, which can not only tell you what is going right and what can be the opportunities for improving that. For example, if there is a digital twin of you which is created, and you can actually try a few different approaches for your health improvement on that, like you want to put few electrodes to see how the heart will work. Or if you want to do a surgical procedure, you can try it on the digital twin and see which one works better. And that solution which works better gets applied on a real human being. A twin helps you make a decision, and a patient gets to make a decision, and then you drive to a point where you become healthy. And we are excited. We are excited about the possibilities of combining these solutions. Creating a personalized GPS for health, a personalized guidance for health. And this cannot happen without engagement of a lot of like-minded technologists around us. They need not be coming from healthcare background, and they can be coming from different backgrounds, but everyone can play a role, because what we are talking about is not a small problem. It's a problem of humongous nature. So we are excited to really look at partnering here. And as you can see behind me, the campus that you see is a new innovation center that is going to be created in India. And here is where we are looking to really make a difference to the world and to the country by actually creating this solution in partnership and in collaboration. And I believe the future of the health of mankind is definitely going to be much better with the acceleration of these digital solutions. So with that, thanks for giving this opportunity to share my thoughts. It's been a privilege to listen to all other speakers so far.
Thank you so much, Mr. Dilip. We are also extremely happy and looking forward to a future where managing health is the priority than seeking care once a disease occurs. I now like to invite Mr. Chandrasekhar Sibal, Senior VP, Fujifilm. Over to you, sir.
Thank you very much, Ramya. And it's a great presentation and from Dilip, and it's completely it's a very exciting kind of a thing that he has placed in front of us about the patient perspective. So a lot of things we have been able to learn from his presentation. It's an excellent kind of a presentation where the patient perspective has been given here. So I would like to start my presentation. So Ramya, so should I share my screen or?
Yes, you can share your screen.
Okay. So I will start my presentation with Fujifilm, that what we are doing in Fujifilm and how the digital transformation and digital technology is helping in healthcare. So actually, I will start with our President and CEO, Mr. Komri. Actually, he has written a book called Innovating Out of Crisis. So that book was written when our core business was vanishing. Our core business, that was a photo film. And it vanished all of a sudden because the digital camera came. And at that time, the company has not only survived, but also thrived. And many other companies have vanished during the time or become the bankrupt. So this was the digitization that happened. And that from 2000, you can see that our 75% revenue used to come from the magic roll or the film roll. And it has become zero, almost zero in 2010. The kind of so the digitization in our company is very, very important. We say that either digitize or die. So that is the kind of thing you have to do, and you have to prioritize. And for that, there was some kind of philosophy from the company side was there that some companies are there who respond to change, some predict change, and certain companies are there which create change. And Fujifilm strategy is to be the company which creates the change. We as a Fujifilm, we are into healthcare in a big way. And you know that we were a photography company. And now we are into the healthcare field in a big way, and we are number one or number two in all the fields where we are into there, like computed radiography, which digitize the X-rays. We have almost 50% market share, as well as a lot of other technologies we are developing. And now we have also taken over Hitachi Healthcare, and we are going to have CT, MRI. So we'll be in a big way in healthcare. So just I want to start with the healthcare informatics and the role of healthcare informatics in hospital setups actually. So I was talking to a few of the hospitals today for this presentation, and what kind of advantage which they got from the role of digital technologies. So we have the PACS, RIS system, the 3D system, and the mobility system. So which provides a kind of a seamless, fast, instantaneous access to the images. So it is giving the better image quality, mobility anywhere, integrated RIS with the reporting. So that is there. With the 3D, they can immediately fast, they can move. With the help of the mobility, they can see all the images on their mobile phones. And even in COVID, this has become very, very important because many of the senior doctors were not able to come to the hospital. So they were able to see the images from their home, and they were able to report wherever they are. So these kind of things are very, very important. So this has become now the integral part of their day-to-day working. Now the people cannot work without these IT systems or healthcare informatics being used in a hospital setup. So very, very important setup. And also now creating the AI and combining the AI with the healthcare systems has become very, very important. And for screening the patients and employing the CAD is very, very important. And recently, Fujifilm has tied up with the NTB program, TB Harega or Jitega, in India Jitega. And we have tied up with Union and USAID. And we are now running a van for 9 months, which will go to 25 locations and scan almost 100 to 200 patients every day. And with the help of AI, this will detect the TB. So this is the kind of things which is actually now working, and we are scanning almost 100 to 200 patients, and we are seeing that almost 10% of the patients we are getting from those population. We are basically scanning the truck drivers, the people in slum areas, also the people who are near the factory, where the cement factory or the coal factory is there. So those kind of things are there. So there, more and more people are vulnerable to the TB disease. And we are using those AI technologies to detect those things, because a doctor, you cannot get the radiologist to report these. So many images are there, so many patients are there. To scan such a large population, you require AI, which can immediately give you the results. And we have also designed a machine, which is a 3.5 kg X-ray machine, X-Air kind of a machine, which has a very high battery life, and this can work in any conditions. Very, very hard machine, and only a 3.5 kg. It's like a camera kind of a machine, which can go to any nook and corner and any point of care place, and we can scan a patient immediately and give the results with the help of AI. So also in India, we are doing that. We are opening the screening centers, which are enabled by AI to provide you with the 10 top cancers. That early detection of the disease or early detection of the cancer is very, very important, or key to success, because once you detect the cancer at an early stage, it is very, very important. It is very easy for doctor to handle that. Also, the cost of treatment is very less. So we have tied up with Dr. Kutti's Healthcare, and we are making 100 centers in India, which will detect 10 common cancers, and which will be kind of an early detection of cancers. And this will help to reduce the mortality rate because of the cancer. We are also have tied up with the Krishna and for the public-private partnership projects, where we are doing is that we have installed X-ray machines or CR systems across many, many states now. This is the example of Assam, where more than 120 machines have been installed. All are being connected through a kind of a cloud, and centralized reporting is happening. And within 1 hour of that, the patients are getting the results. So this is also providing a lot of help in those far-flung areas where it is very difficult to reach. But with the help of teleradiology, tele-reporting, and public-private partnership, these things are now happening. And we are now expanding these things to many, many other places like Punjab, UP, Maharashtra, many, many other places that Krishna has tied up. And we are providing them our technology as well as the equipments to scan. This was the program, which is a never stop screening to reduce the diagnostic delays, a mobile X-ray screening initiative for TB and TB Mukt Bharat. And this was also our Prime Minister's call for end TB by 2025. So we are going to have this. This van is running, and a lot of places like truck drivers, migrant workers, slum dwellers, rural semi-urban population around the industrial pockets. We are scanning every day, and we have launched this program in August 2021 because the COVID was less, and also there was this thing that TB was increasing. We could see that our focus on TB was reducing at that time. So in India, and this is the small. You can see the small X-ray machine with the laptop. So this will give you instantaneous result there only, and you will be able to get the to know through the AI only that whether the person is having TB or not. So this is helping a lot. Going to many places, we are creating a lot of nukkad natak, etc., to get the patients to come to this van and get scanning done. So we have also gone to Uttarakhand. So many places we are going. Also, COVID-19 pneumonia image analysis program is there, which we have launched a CAD or a AI kind of a thing. So this will also help with the help of CT and MRI images. This will help for the diagnosis of chest CT images, and they'll be able to know whether pneumonia is there on the chest CT. So with the help of AI, so this is also helping a lot. So basically over this National Digital Health Mission also, I would like to say that I was discussing with my the Japanese counterpart here in India that they also had this program in Japan where they also have a health card and etc. But they say that it never worked actually. So we'll have to go that these cards can be made, but to make it work, it will require a humongous effort from government side, also from the company side to reduce the cost. Because to provide the healthcare to 1.3 billion people is a humongous task, and also to store the images, interoperability. So we'll have to design the solutions which are very less in cost and very rugged in their working, because you require very good softwares which can have all these data, access of these data to anywhere. So these kind of things will definitely help to improve the healthcare in India. And the patient trust factor, which everybody has talked, and I think Mr. Kiran Karne and even the Mr. Sanjeev Malhotra and Mr. Mohsin Wali. So the trust factor will also improve once we have all the digitization, which will happen. So we will be able to get the accurate diagnostic, and which will be also lesser to the patient cost also, because the cost of this treatment has to be also reduced. Once we make in such a high numbers and the volumes are so high, so software can be priced on a very less cost, and this will help improve the trust and transparency. So that will overall provide us the better. So digital healthcare will definitely provide us the better solution for our problems. Thank you very much.
Thank you, sir, for sharing the impactful work that Fujifilm is doing. And we would love to collaborate with Fujifilm in the future. Thank you again for your time.
Thanks a lot.
More than most of the sectors, healthcare sector is heavily regulated, and not without reason, as lives of patients are at stake. It's imperative for solution developers to have a good understanding of regulatory aspects so that they don't face hurdles at the time of development and provide solutions that are interoperable. I now invite Ms. Manisha Mantri, Joint Director, NRCES, CDAC, to present the regulatory keynote. Over to you, ma'am.
Thank you, Ramya. So first of all, thank you so much for having me here on this platform, and I'm very fortunate to be there amongst all these distinguished guests, especially Dr. Wali, Mr. Kiran, and we have been hearing to Mr. Dilip, Ms. Shainika, and Mr. Sibyl. And I'm going to touch upon where we all have talked about different aspects of healthcare innovation with using modern technologies. I'm kind of touching upon a different aspect which has come in between with the every speaker about standardization and interoperability, and I'm going to let you go through the digital health policies and initiatives happening in India from government side. So we kind of see a very large digital health landscape where we have solutions for different use cases, as told by Dr. Wali, that you need different solutions for different problem statements, and you have EMR, EHR solutions, you have diagnostic solutions, you have mHealth, personalized health app, wellness applications, and so on. And what has happened is recently the focus of the healthcare IT development has moved and moved to the healthcare data as one big focus, where we want to look for the statistics, we want to see the dashboard, we want to see what is coming out, we want to see the data being reusable, interoperable, and we want to look for the policies on how do we structure, organize, and manage the health IT. The overall intention and goal is just to have an efficient execution, transparency and accountability of the operations workflows, the automation. We want to extend reach, as said by Mr. Dilip, that we have an unfair access. So we want to extend the reach. We want to address the supply chain issues in terms of distribution of medicine, healthcare services, telemedicine, the telehealth, and through PHR, EMR applications. So what has happened over the years? So when we try to look at the evolution of healthcare IT policies in India, way back it started in 2003, where MCIT, now MIT, has kind of defined a framework for IT infrastructure for health in India, and then the work started from there slowly. But the major milestone that has come up is the notification of Electronic Health Record Standards for India, which has come in 2013. And followed by that, there were a lot of proposals, a lot of ideas. The different proposals for the acts have come up. And later to that, we have got digital health as one big agenda in our national health policy in 2017. And followed by that, we have the National Digital Health Blueprint being notified by Ministry of Health and Family Welfare, followed by the telemedicine practice guideline, which gave a legal existence of telemedicine practices in India. Of course, that's the best thing that has happened with the pandemic in healthcare. And later on, the big boom happened is having the National Digital Health Mission pilot implementation announced by our Honorable Prime Minister in 2020 during our Independence Day speech. And then the recent announcement of Ayushman Bharat Digital Mission, renamed NDHM, just 2 days back on September 27. So I just would like to touch upon the different health IT policies, the healthcare and the ICT policies and regulations that are there, that are coming up, which are available, which one should look into. The important policies that we can refer to is the National Health Policy 2017, where it talks about how the digital health technology ecosystem can be developed, how we can leverage teleeducation, telemedicine, and different digital tools for Ayush services and practitioner. How do we develop the information databases in healthcare? So there are a lot of initiatives that have been started, referring to the National Health Policy 2017, and there are so many still we want to go ahead for. Apart from that, we have the National Digital Communication Policy, which talks about how do we create the robust digital communication infrastructure in our country. And then the national policies on electronics, where if we are kind of planning to develop the R&D devices in medical electronics, that's the policy that we should refer to. And then there is a national policy on software products just recently released in 2019. And the most important from the health IT perspective is the National Digital Health Blueprint, which was released in 2019 and has laid down the stepping stone for building a national digital health ecosystem in India. The work also started to look into looking at the aspect of data privacy and security. So we have the Personal Data Protection Bill coming in 2019. It is there for recommendation in the Parliament. We have the telemedicine practice guidelines for allopathy, as well as the different disciplines in Ayurveda, Siddha, Unani, homeopathy, and other disciplines. And we do have, there were a lot of problems and discussions happening on usage of Aadhaar, and then there was a policy and rules that was released for using Aadhaar for authentication and for the good governance. And yes, we do have the NDHM, which has recently released the health data management policy as part of the NDHM workflow altogether in 2020. So we just talked from the standards perspective. So EHR standards for India were released by Ministry of Health and Family Welfare in 2013 and were revised in 2016, which covers all the set of EHR standards which can lay down the foundational, structural, semantic, and organizational interoperability within health record system. So the different standards were identified and adopted for use in India. There are detailed recommendation provided in the EHR Standards for India guideline on the different aspects of standardization of particular set of standards within the healthcare systems. Even the short guidelines are also provided for every specific standards. The overall vision was to kind of look at building interoperable healthcare ecosystem in country. So these EHR standard recommendations were the important stepping stone when standardization started in India. Related to that, various efforts were taken by the government of India and the Ministry of Health and Family Welfare, where India became member to SNOMED International to ensure that SNOMED CT clinical terminology, which is the key for ensuring semantic interoperability in health records, is available for free to every members in India. A national resource center for SNOMED CT was set up at CDAC Pune. And later to that, the resource center was given the task to support adoption of all 35 sets of standard in 2017. These standards are promoted at central and state level through various notification. A lot of EOI or a lot of the tenders would require standards in place if one wants to kind of deploy a healthcare system or a software or a device in a government setup. The ministry has also released the National Digital Health Blueprint, which has the specific mention for use of digital health standard, which covers the various aspects, including data content, data exchange, security, and consent management. So the set of standards, I would not go into the details. So they take care of the content, data exchange, security, access control, consent management through the different set of standards which are recommended. So coming back to the Ayushman Bharat Digital Mission, which was once erstwhile called National Digital Health Mission. The Ayushman Bharat mission aims to develop a complete backbone which is necessary to support integrated digital health infrastructure of the country. And the Ayushman Bharat Digital Mission also adopts standards as envisaged in National Digital Health Blueprint. It supports all the health record standards. So any application or any healthcare software which wants to kind of share data over the over this digital health backbone have to adhere to these standards. So that's an implicit requirement for being onboarding into the ABDM network altogether. And the overall vision is to have a universal health coverage. You would see that the NDHM was announced in August 2020 for pilot implementation in 6 UTs, and now the nationwide implementation has been announced. So this is the pace in which India is currently leading the healthcare IT digitization and the development in the country. So coming back to the National Resource Center for EHR Standard, the Resource Center was formed by Ministry of Health and Family Welfare. It supports facilitation for adoption of the notified EHR standards within the healthcare applications in India. The support is provided to all the stakeholders in healthcare, including public, private, healthcare vendors, implementers, hospitals, and it acts as a single point in contact for providing any information about EHR standards in India. The Resource Center provides free and open source tools, software development toolkits for integration of standard. It provides the know-how, support, and training for adoption of standard. And in fact, the Resource Center is pioneer in developing and customizing digital health standard which suits our national need. The NRCES has also recently released the common drug codes for India, which are to be adopted for use within the healthcare systems in India. The Resource Center also provides implementation support. So if there are any queries or any issues of integration, data sharing at the technical level, then the Resource Center is ready to help the community, the hospitals for that also. And it is also act as the interface between the standard development organizations to ensure India's requirements have been taken care of at international level. It also works in very closely with for building the different building blocks or providing assistance in development of these building blocks from standards perspective to the National Health Authority. So I would kind of talk about few notable development. Of course, pandemic has proved boosting use of telemedicine, but NRCS in last year tried to help the Telemedicine Alliance for building this telemedicine registry and evaluation, and we found that more than 109 telemedicines are there in India, which with the different use cases. So only in this registry, there are 109, and many of those applications support standard and adopt standards. There are more than 10 lakh teleconsultations happen in the government hospital in last year. And there is an initiative started for standardization of Ayush systems of medicine, where the standard clinical terminology for Ayurveda, Siddha, and Unani has been developed and is in progress. And if you can see, there are 300 plus implementers there already onboarded on NDHM, ABDM for now. And then when NRC NRC do not ask for any of the information. However, there are some 22 odd self-declared standard or compliant healthcare applications out there with NRCS. The list is there. And there are many public and private implementations available who adopt standards. So a few of the list are out there. So from my side, the takeaway would be to everyone who is there on this platform today is build the digital health solutions that are future ready, that are standard compliant and interoperable by design. So it's no more a feature, it's a basic requirement, I would say. And build the applications which are user driven, which are patient driven, your healthcare provider driven, and ensure that the important policies being followed to support this overall building of healthcare ecosystem in India. And try to leverage the existing infrastructure as speaked by Mr. Sibyl that there is this unique health identifier being generated, the health cards being generated by NHA for building this ABHM. Then try to use this existing infrastructure so that we have always a complete ready digital health ecosystem built and everybody contributes to it. There are new discovery services coming in future, like healthcare facility registry. We will have the healthcare provider registry, and the whole HIE backbone will be there. So we can be one of the key players, and we should be future ready for adopting the new things happening in healthcare. That's what I would say. And thank you so much.
Thank you so much, Ms. Manisha, for your detailed walkthrough of regulatory aspects. I'm sure startups here are going to benefit from the knowledge you've given us. Our hospital partners play the central role in this initiative. Without their participation and support, this initiative cannot even get off the ground. I'd like to now invite Dr. Karen Priyadarshini, Regional Leader, Healthcare, JAPSC, Microsoft, to lead the discussion with our partner hospitals who have brought their use cases for digital technology adoption. I'd like to also invite Mr. JP Dwivedi, CIO, Rajiv Gandhi Cancer Research Institute, Mr. Manish Kumar Rai, Head IT Zydus Hospitals, Mr. Chandra Mauli, CIO, Shankara Netralaya, Mr. Srini Venugopal, Group CIO, KIMS Health, and Dr. Vasant Venugopal, Consultant Radiologist and Head of Imaging Research, Mahajan Imaging. Over to you, Dr. Karen.
Yeah, Ramya, thank you so much. And a warm welcome to all of you. Very good afternoon as well. I would be great if Shantanu, if you can help with the slides. So just as an intro, I'm the regional business lead for healthcare industry vertical at Microsoft. And I think the last 2 hours, 1.5 hours was just amazing. Learning a lot about, some of the amazing work. In fact, I was busy taking down notes as well. And before we begin, I would love to kind of thank our healthcare strategic partners, AstraZeneca, GE Healthcare, and of course, Siemens Healthineers as well. And of course, our association partners and media partners for putting together such an amazing healthcare innovation challenge. So would love to kind of introduce our key panelists for the session today. So we have, if you can go to the next slide, we have a very, very august panel members today. We have Mr. Chandra Mauli, who's the CIO of Shankara Netralaya. We also have Mr. JP Dwivedi, CIO of Rajiv Gandhi Cancer Institute. Mr. Manish Kumar Rai, who's head of IT Zydus Hospital. Mr. Srini Venugopal, who's a group chief information officer at KIMS KIMS Health. And Mr. Vasant Venugopal, who's a consultant radiologist and head of imaging research at Mahajan Imaging. So a warm welcome to all of you, and really look forward to the discussion we're going to be having as well. So before we go ahead with the individual sections, just want to kind of share a little bit about the use cases that have been nominated. And I guess as we've been hearing all the speakers speak prior to this, we do see that digital transformation has actually kind of accelerated during this whole COVID period. And since at Microsoft, I handle the healthcare vertical for the JPAC region, I kind of see the acceleration that has happened, not just in India, but also in the many markets. Normally, I don't know if you'd agree with me, but healthcare has always been a laggard. We've always had finance, we've had retail, always kind of leapfrogging when it comes to technology. But this has been, I would say, a golden era in healthcare, when you see, one of those very, if I can use the word, iconic period where you see a lot of transformation that has happened, which probably one wouldn't have seen in the last 20 years. So for today, we have these very interesting 6 use cases, and I'll probably briefly go through them before I hand it over to the expert panelists. So the first one, as you can see, is around integrating radiology reports into patient-friendly multimedia files and reports. I think this becomes important, and to what the previous speakers have also been speaking about, where you're looking at being able to integrate your radiology reports into, let's say, an EHR or even into an EMR, where you're bringing these different pieces of information together so that you have a full patient 360-degree view. And then we have, thanks to, I think, one of the positive effects of COVID, we have home care and remote patient monitoring as well. I think telehealth is another area that has really kind of boomed. And we had Manisha share on all the interesting policies that have kind of moved or riveted towards digitalization. I want to kind of just spend a minute around home care and remote patient monitoring. You know, one of the reasons that, one of the things that we saw around the COVID period was where a lot of elective surgery got pushed back. And a lot of patients who would, you know, go in for the regular checkups actually couldn't go because of the entire COVID pandemic. So this has been a boon where you're looking at being able to kind of monitor patients from home. There are two benefits. One, they really don't have to go to the hospital. They free some of the resources in the hospital. They don't have to queue at the A&E or at the OPD. And the other thing, and the most important thing research has shown, is that when you have continuous monitoring, right, and you're able to monitor the patient more frequently than, let's say, once in 3 months or 6 months, the outcomes are much better. So I think this is an area where even at Microsoft, we see a lot of focus on being able to kind of, you know, we have things like virtual visits, virtual wards as well, where you can create a ward in the comfort of your own home. And for some of the patients who need regular interventions, I think this becomes a very, very useful tool. Then, of course, hospital automation. I think this is like a no-brainer, if I can say, because in many, many hospitals, we do see that some of the very basic processes which could be automated are still very manual. And I think this is a very important pillar where you're saying, how can I not just increase patient outcomes, but make the whole experience very comfortable? You know, things like sometimes we talk about digital hospitals. I mean, that's way off, but even automating simple things like the registration process, the discharge process, some of the, I think earlier on, Shayanika was sharing about how, you know, you can have speech to text, where doctors really don't have to type so much, but they're able to kind of, you know, just speak, and that gets transcribed. That's one of the acquisitions that Microsoft has made with Nuance, because research has shown that of the 7 minutes that doctors spend with patients, they spend about 4 minutes just typing out their notes, right? So that's hospital automation for you. And then, of course, we have centralized teleradiology reporting, where you're looking at having a single repository of all reports of radiology. So you're able to access it wherever you might be. And then I think a lot of, I think we had Dilip and we had Mr. Siebel as well sharing a little bit on around cancer. So I think AI-based cancer diagnosis, this is, I think what Dilip had shown as well, apart from cardiology, cancer is the second biggest killer. And so this is where we are looking at totally decentralizing cancer diagnosis. And I think I was very impressed with what, Mr. Siebel was showing as well, where, you can have the same quality of care at the last mile access. And I think this is where you're looking at democratization technology for healthcare. And the other very interesting part is that being able to do predictive screening, not just after you're diagnosed with cancer, but being able to kind of predict it in a way. And I think that was beautifully shown for TB, as well as, you can extend that to any other type of cancer. We're able to capture through AI the very initial signs of an onset of a malignant cancer. And last but not the least, digital clinical assistant. This is my personal favorite for integrating with legacy EHR. At Microsoft, we look at it also as a digital clinical assistant, as a health bot as well. So the health bot is like, can pull in the information that you need. All that the doctor needs to do is to speak into it. They're able to kind of pull out data. So let's say the doctor is in a car and he's going to see patient X, and he tells the bot, hey, can you show me the medical record for patient X? And the bot pulls out that information, and also letting the doctor know when, let's say one of his patients is being readmitted within 30 days. So how can you kind of use the bot to kind of let the doctor know that, hey, that patient that you discharged 30 days ago is back in hospital. Or if you've ordered a lab report, that lab report is ready. And so even before the patient gets to see it, you already have it at your fingertips. So there are multiple ways in which the digital clinical assistant can be used. And I really kind of look forward to hearing from all the panelists on some of these sections and the winners that are therein as well. So probably I'd like to invite, without much ado, Mr. Chandramouli, who's a CIO for Sankara Nethralaya, to kind of take us through the digital clinical assistant. Over to you.
Yeah, thank you. Thank you so much. I think you gave a very good summary of all the emerging things that this HIC2 really wanted to accomplish. For the brief input of people who are on the call, Sankara Nethralaya is one of the largest eye hospital in the country and rated top 100 across the world. And we have a very extensive EHR implementation done over the last 15 years or so. And one of our major digital transformation ideas that we are trying to do is primarily to look into how to make information actionable. We set this goal kind of 3 years ago. And there are various aspects to that. There are 5 different aspects to that. And in fact, thankfully, we have also been represented in the national level on the setting standards on EMR and things like that. We have been part of this EMR standards. And so we were kind of forewarned on what is happening as far as the National Digital Health Mission itself is concerned. So we want to get ready ahead of the curve. So one of the things that we really found was the data interoperability. Our bigger idea is to see that we create a digital mission for eye care across India and trying to integrate most of the eye clinics across India, because thankfully for Sankara Nethralaya, more than 10% of the doctors are ex-alumni working across the entire country. So we want to create our best practices which can really flow in across the world, across India at least, and make or kind of disrupt the OPD itself and provide a lot of smart data that can really transform the life of the doctor much easier. So, and we realized that SNOMED is definitely the way forward, and we wanted to see that how we can pick data from our EHR when the patient really walks in and do a smart coding using the SNOMED CT and also map it to the ICD-10. I think these were the challenges, which we really posted to the HIC. I think I'm very comfortable to see that many people had responded, and there are 5 finalists who are as good as each other. And unfortunately, we had to pick only 2. So I think based upon the unanimous decision of the jury, I think 2 different companies are going to be selected today. It's not that the others are bad. I think we need to have, like I told you, we need to just pick 2. SD was definitely had a comprehensive solution end-to-end. I think that was one of the reasons we picked up SD as a winner. And IBIS came a close second, although they are not from India. I think the kind of work that they've done across the world really gave us comfort that this is something that we can really look into it. I think congratulations to both the teams that you really did the job very well. And we are certainly keen to see how we can make the best use of their technology in India. One small ask to those innovators who are the winners today is to see whether we can make these technologies widely used in India, make it more affordable, make it more, because we have 1 billion+ people who need assistance in some way or the other. So the Western ideas of cost and availability have to be completely different from an Indian context, actually. I think those are my 2 specific requests to the winners. And congratulations, everyone.
Thank you so much, Mr. Chandramouli. So absolutely agree with you. I think technology is best when it is when you have economies of scale and that reduce costs. Absolutely agree on that. So would like to invite Mr. Vasant Venugopal from Mahajan Imaging.
Hello, hi, good evening, everyone. I'm a radiologist by practice, but now I lead the research division of Mahajan Imaging, where we built a platform called Carpal, through which we are integrating AI solutions that can be used in radiology clinics. So this use case is very kind of personal to me and some of my colleagues. The radiology report, the way it's been structured, has been like this for quite many years now. since the years I started reading medicine and doing radiology practice residency, it hasn't changed much. One of the major problems with not only with radiology reports, in fact, with other reports like even pathology, microbiology reports, they are not very patient friendly, right? So in fact, they are not even, I would say in some cases, not very physician friendly also. They are filled with so much of technical jargons, right? You always need to call back your radiology colleague or even a clinical colleague to understand what that report actually means for you, right? So that's one thing which I wish we could change with so much innovations coming in NLP and image interpretation. So this particular use case is around how could you take a radiology report and the images which are provided with those reports and convert it into such a file which is a patient friendly and also has very kind of interactable hyperlinks to either resources on the web or even connected to the image sets of image that are provided along with the report. So that's the idea behind this pitch. And can we go to the next slide just to declare the winners? And almost every participant kind of figured out various components of the pitch in a very unique way. And again, we have to choose one winner. Unfortunately, that's the way awards work. And N dimension, according to the opinion and consensus among the jury, was the one which had figured out the patient friendliness component of the pitch, where they are in fact they have worked on a chest X-ray report and they have created a solution. Maybe that's in the beta phase. We would probably work with them to take it to maturity and clinical deployment, where it reads the chest X-ray and kind of provides hyperlinks and text links to certain clinical terms in the report, and also uses an image interpretation algorithm to figure out where exactly the lesion that's being mentioned in the report is on the image, and it kind of highlights that part of the image. So they are declared as the winners according to the consensus decision. And the solutions by Deep Tech and teleradiology solutions came very close to what N Dimension had. The only difference is N Dimension figured out the patient friendliness component of the pitch. The other solutions were more again towards addressing to the physicians and radiologists, and kind of still figured out the way to integrate multimedia options. One solution, Synapsica by Synapsica, was also very close, but unfortunately, I think they didn't. There was a technical element to that. They didn't pitch for this particular award, so we couldn't kind of evaluate them on that component. I'm very happy the way which is the reports are being kind of generated to address the needs of the change in the healthcare domain. Thank you.
Yeah, thank you so much, Vasant, and a big congratulations to both the winners. And I'm really happy to hear that you're quite happy with the product as well. And would now like to invite Mr. Srini Venugopal from KIMS Health. Srini, if you could take us through the teleradiology reporting and the home care and patient monitoring solution would be great.
Sure. Thank you very much. Hi. So just a quick introduction of our hospital, because there are a number of KIMS in India, so people get confused with who we are, and we quite often get mistaken for the other couple more KIMS. So we are Kerala Institute of Medical Sciences, and we are branded KIMS Health. And as a hospital, we provide quaternary care services. We are located predominantly in Kerala, with 4 hospitals, and we are also in 5 different locations in the Middle East. Altogether, we are around 1,000 doctors and 2,000 beds in terms of size. These two use cases are very real and very close for us, because these are things that we are currently working on in the hospital. So these 2 use cases: number 1, centralized teleradiology reporting. This stems from the fact that as a hospital, we have grown organically to some extent, and to some extent inorganically, because we have acquired or we have become part of other hospitals. And we find that these hospitals then come with their own IT systems, including their own RIS and their own radiology reporting systems. And then we end up having a need to have a more comprehensive, integrated way of addressing radiology, where we needed to have a centralized radiology reporting center with ability to connect all of these different hospitals, the radiology information system in all of these different hospitals, bring all these reports together, and then very efficiently manage the reporting of those modalities. And as part of that, we also needed to make sure that we had very good data analytics and dashboards and ways to make sure that to give us visibility into how this was progressing. We also wanted to have an element of AI brought into the way in which these radiology images were processed and how we could pre-identify clinical conditions before it went for reporting to the radiologist. So that was the first case study. The next one, do you want to go to the winners for this and then come back to the second case study, or?
I think you can probably share both, and then we can, have
sure,
the winners one by one as well. Yeah.
Okay, that's good. Okay.
Thank you.
The second case study is very real from a perspective of COVID. I think you started saying, Karan, that at the beginning of COVID, it was very difficult for patients to come into the hospital. They had to postpone elective surgeries and so on. And for this particular reason, we also felt that there was a very innovative way to take healthcare to the patients, to their homes. But once we complete the treatment and come back, we don't have visibility anymore. So we wanted to look at what were the possibilities in the market, what were the startups building, where we could have solutions to continuously monitor patients, particularly post-operative patients, critically ill patients, where sitting in the hospital, we could gauge their condition and have the right reports, the right vitals being streamed to us, have a certain amount of AI that can predict patient deterioration, and again have the whole administration and the reporting around that. So that was the second case study, to have patient monitoring from their homes and to also integrate a complete home care solution, being able to have teleconsultation with the doctor and all of that bundled into one solution. So these are the two use cases. We can go to the next
winners.
With the winners. Yes, please. Right. So here I'm very happy, and congratulations to the winners. For the centralized teleradiology reporting, the winner is N-Dimension. We sat through, I think, 6 or so different companies and startups that presented. We really want to thank all of them. All of them had very good solutions, when you choose a winner, then they win by a very close margin to many of the other solutions. So congratulations to N-Dimension, and the runner-up for this is teleradiology solutions. N-Dimensions came with a very good proposal, and personally, it quite suited what we were looking for. There was a lot of integration, including chatting with the technician during the radiology service. They had already integrated a few different PACS systems, the same ones that we were using. And I think unanimously, the judges felt that that was a good solution. So congratulations to N-Dimension. Deep Tech Teleradiology comes in second as a runner-up. Again, a great solution and a good comprehensive presentation from Deep Tech. We can go to the next one. Yeah. For home care and patient monitoring solutions, we have the prize is jointly shared by Helixon and GeoView. Both excellent solutions. Helixon particularly had a very strong product, including virtual rounds, and there were many of the home care related aspects mirroring real consultation that could be done within the system. So great solution there. They could collect patient input, patient could enter information in addition to what the system would collect, and very comprehensive solution. And for the second one, for GeoView, again, very comprehensive, very good solution. The team was extremely passionate. They had built something which was very relevant from a social context, and they were very passionate about the work that they were doing. They were able to bring in the home care element in a very cost-effective way to the general public. So both great solutions. Very happy to be part of the panel. Congratulations to both the winners.
Yeah, thank you so much, Srini. That was really very nice. Yeah, fully agree with you on that. So great that, we had some very good winners. And as you rightly said, the winning is always with a few points, right? I mean, it's always well contested. So nice to see that. I would like to invite Mr. JP Dwivedi, the next for the section on AI-based cancer diagnosis. I think something that's very pertinent today as well. So JP, over to you.
Thank you, Karen. So I represent Rajiv Gandhi Cancer Institute and Research Center. This is one of the most prestigious cancer centers in the country and the largest in the northern part of India. So first of all, congratulations to NASCOM COE for arranging these sort of arrangements between the supply and demand sides of the business. And I have been part of their effort for past few iterations. And every time I see a progressive improvement. So a big congratulations to Sudhanshu, Shantanu and their teams. And then coming to the use case, we in our Rajiv Gandhi Cancer Institute, if we look from the patient's point of view, there are 4 different aspects that we look at. Number 1, patient safety. Number 2, clinical outcome. Number 3, cost. And number 4, patient experience. You look at it, application of AI in diagnosis that helps in all the 4 aspects. And kudos to Dr. Venugopal, who so honestly accepted that the radiology reports are neither patient-friendly nor doctor-friendly. So we need to do something to make them not only friendly, but make them impactful in all 4 aspects, ensuring patient safety, improving clinical outcome, making it least expensive, and then improving patient experience. I mean, if you look at it, rather than undertaking 2, 3, or 4 different tests, if one test can appropriately diagnose the problem, it will help the patient not only in saving the cost, but also in improving the experience. You select the least invasive test and then complete the diagnosis. This cannot happen with the naked eyes or the microscope only. AI is now going to play a big role. The other is convergence between the radiology and pathology. We have now from radiology, we came to PACS, where the digital images are stored, filmless images are there. Now those could be easily analyzed. Similarly, now we have digital slides, digital pathology. And when we have stores of both these images, it is very easy to converge. And without any extra intervention or extra test or patient's involvement in all these tests, let AI play its role. And that was our vision, that let it converge. Number 1, let it improve the accuracy of the diagnosis, speed of the diagnosis, least invasion, and the lowest expense to the patient. So with this kind of intention, we came to NASCOM, and they have arranged a good 4 suppliers for this, which we were very happy to see. And I am further delighted that 2 out of 4 were already working with us, and we did not know that few of these dimensions they had. So let us move on to the next slide. Yeah. So the winner is curative, and the runner-up, there was a very close contest between the ERA Matrix and Onward Assist. So big congratulations to the winners. And I mean, I must say that the 4th one, which could not make to it, was also not far behind. But, again, it was a kind of consensus decision that everybody cannot be declared winner. So congratulations to them as well. And I encourage them to move up further and do better next time. Thank you.
Thank you. Thank you so much, Mr. Dwivedi. I fully agree with you that I think patient experience is super important, because research has also shown that when the patient experience is very good, people actually recover faster. And you're spot on the digital pathology side, because one of the things that we have seen at Microsoft is also that with digital pathology and AI, you're able to kind of detect diseases well in advance. You may not even be looking for that disease, but using these digitalized images, you can actually go back to them 4 or 5 years, for example, down the line and look at some of those images as well. So absolutely agree with you. Would now like to invite Mr. Manish Kumar Rai on for giving his comments on the hospital automation part. Manish.
Okay. Yeah, thank you. Very good afternoon to all of you. Now, myself, Manish Kumar, I'm representing Zydus Hospital. We are 900-bed hospital in Gujarat. So our use case is the hospital automation. Suppose I'm talking to the call of the automation. Automation is very used thing in all the industry. So basically, we focus for two model. One is for OT and second for the supply chain. Now, every HIMS have the feature of OT and we can capture the data also, but doctor don't have time to do all the things manually. They can write all the things and they have to go to the OPD and patient round. So our main focus is automation. Suppose I'm talking about the automation. Automation should be like, it should not be person driven, it should be system driven. So basically our focus for the OT booking, PAC status clear, OT utilization, and based on the OT utilization and surgery system should book the equipment, what the equipment record, how many equipment we have, we can get the analysis, and most important the TAT, like how many time patient was in OT and what are the TAT was there for which surgery, how many tentative times, so we can convey to patient accordingly. Like suppose if my family member in OT, we are waiting outside and we have okay, what is happening, I don't know, we can't see the thing. For this we are the automation, like before the surgery we can inform to the patient this time it will take for the 10 minutes, 40 minutes, 30 minutes, and it is very useful for the doctors. Like they don't have to type all the things, just they do surgery, dictate all the things, and it should be captured in the system. Then and it should be go to the discharge summary. That was the first use case. And second use case was the medical supply management. Now everyone have HIMS and the reorder level and all the things, but I didn't see like automation of based on the consumption. So we are looking for the consumption based medical supply management. So based on our past consumption, like during I'm talking about the COVID time, some unwanted activity was happening. Like normal day consumption was 30, but during COVID time consumption was around 2 lakhs. So real time we can get the stock control, like how many goods is going consumption and what should be ordered to the next order next time. This is our requirement. And second was basically focus for the like everyone have a good different system. Like suppose I'm receiving good every at a different template. Some is handwriting, some is system, some is using Oracle. So we are looking for the basically a through scan AI. This through scan it should be converted to our HIMS or it should be converted to the Excel. What is the data entered in the system? So there is no manual. Like every time around 1,000 batches there, and at time user done 1% mistake, it will be go around 100 to batch case, wrong expiry date, wrong batch code, and it will impact on our business. So this is my use case. Can you go to the next slide, please? So we saw winner is the care expert. They have good model. Now we are going to this after the we are going to start the implementation process with care expert, and runner up is Creo. The Creo is a very good system also. So we look forward for the future with tie up with the both care expert and the Creo health. Thank you.
Yeah, thank you so much, Manish. I think fully agree with what you said. And I think during the whole COVID vaccination time, this became very important to understand, what's the demand versus what is the stock that you have as well. So very interesting. Thank you so much.
Thank you. Thank you.
Yeah. So a big thanks to all the panelists. Thank you so much for your time on that. And a big congratulations to all the winners and runner-ups. I know it was very closely fought. But I would like to close with something interesting. So at Microsoft, we do have what they call as a startup program. So if any of you are interested, please do let me know, because what we do is that we help the startups then scale up. So today you're looking at India, but you might want to kind of cross borders and go across different markets. So happy to kind of, if any of you winners are interested, happy to kind of engage with you and help you in that process. So thank you so much. And back to Ramya or to Shantanu for this.
Thank you so much, Dr. Karen. And that was a very generous offer from Microsoft. Thank you so much to all our individual panelists also, Mr. J.P. Dwivedi, Mr. Manish Kumar Rai, Mr. Chandramouli, Mr. Srini Venugopal, and Dr. Vasant Venugopal. Thank you for your time, and thank you and congratulations to all of the winners. Now I'd like to invite Mr. Sudhanshu Mittal, Head and Director, Technical Solutions, Center of Excellence, Gurgaon, for his concluding remarks.
Thank you very much, Ramya, and let me thank all the hospital participants and Dr. Karen for managing the panel discussion, and also all the hospitals who have been partnered with us now, and also those who have been partnering with us like Mr. Dwivedi and Mr. Manish since earlier time. Thank you very much for all your participation. It's your participation, as Ramya said, which is central to this whole program. Our program cannot even start if we do not have you with us. So I would like to thank you, all of you, and now to all the startups. So as I said earlier during the jury session also, that it's not just the winning over here as through the jury, but ultimately it's about the deployment of the solutions. And it's the hospitals or the use case sponsors who ultimately decide as to who is it that they want to work with. So while we have had the kind of unanimity in certain cases about who the winner is and who the runners-up are, ultimately when it comes to the areas of deployment, since there were not many differences, and in some cases we just had to somehow make a decision as to who we declare, the potential opportunities are open to the startups for the deployment, not just now, but also in future. So I look forward to working with all the hospitals and all the startups to see as to how the solutions get deployed on the ground, and then subsequently how they get scaled up. We have this idea also that once we see certain solutions being used, being deployed and scaling up, then we want to define them as a kind of winning solutions, which can be available, put on our website and made available to others also who are looking for this kind of solution, as a precedence that this kind of solution has already been deployed and is working in this place. And if somebody else is looking for that, then they can either just contact that particular solution provider directly, or go through again their own exercise if they are looking for something different. So at the end of the day, I wish to thank everybody, and of course the team, Shantanu and Sonia and others, all the COE members, Shalu and Kashvi, and now Ramya, of course, who has played a critical role in managing today's session. So I want to thank everybody from the COE team, and I think I missed Naman into this. So all those who have been working with us to run the challenge and making it successful. So thank you everybody, and I look forward to working with all the hospitals and the solution providers. With this, we will conclude the session for today, and we will start the HIC3 shortly. So all those who are interested, we look forward to participating with you in the HIC3 also. Thank you very much. And
thanks, Sudhanshu. Thanks.